Good morning. It is 9 o'clock, so we'll go ahead and get started. People will continue to join, and that is just fine. Telehealth Rocks. I'm Christy Gania, and I'm a program manager for Telehealth Rocks. Telehealth Rocks is a federally funded program that focuses on school-based behavioral health, and we do this by working on social determinants, supporting school-based services, and telementoring trainings just like this one. In addition to our speakers, we have several Telehealth Rocks team members here today, Sage Brown, Chase Koob, and Haley Bell here to help. They may be putting items in the chat or responding to questions or chiming in. Feel free to reach out to any of us if you need something. We're glad you're here to talk during this session about neighborhood and built environment. I have just a couple of notes for you as we're getting started. So this session is recorded and we'll send it to you afterwards. Just give us a little bit of time to process it. Your microphone has been muted, but feel free to use the chat or unmute to ask questions. And then it really helps us track attendance if you can put your first and last name visible on your Zoom screen or type it here in the chat to say hello. And then we have no disclosures and everything presented today is evidence-based and currently accepted within the profession. So after the session, we'll share the slides and recording just as soon as we can. It takes a little bit of processing time, but we will send those in a follow-up email to you. They'll also be on our website and Facebook page. Any links and resources that we shared today during the presentation will also be included in the follow-up email. So we'll make sure you get everything that you need. The certificates of attendance will be emailed after the series ends. And then if you have any questions that didn't get answered, make sure you send them to our Telehealth Rocks email address, and we'll be sure to help you out with that. All right, well, I will hand it to Robert and Evelyn to get us started today.
So we're
Thanks,
excited.
Christy.
Yeah, I'm sorry. It is yours, Evelyn. I think
Oh
that.
no, go ahead.
Oh, we're just excited to have some representatives, both from Avenue of Life as well as from the Eldon, Missouri School District today. I'm Robert Stiles. I'm the program director, and I'm going to hand off to Dr. Evelyn Nelson, who is a professor here at the University of Kansas Medical Center in pediatrics, as well as the executive director for both Telehealth Rocks and the Heartland Telehealth Resource Center.
Good morning. It's really great to see everyone on a really cold, chilly morning and start to the new year. We're really appreciative of you joining us this morning. We have three great folks from the community joining us today, really to share some innovations and really exciting things around the social determinant of neighborhood and built environment with Matt Davis of Eldon School District, their superintendent, Angela DeWilde, the development director of Avenue of Life, Cameron Erlandson, the chief communication officer of Avenue of Life, and of course, Robert and I from the Telehealth Rocks program. Next slide, please. So we'd love to start off this morning really hearing experiences that you've had with putting some things into practice from our last session. And what we talked about with the social determinant of health. Really just even, we'd love to hear small things that you've tried or put into practice, anything that we can all learn from one another around this important social determinant of health work. We'll give you just a couple of minutes here. Again, I got my coffee and just, I know we're all getting started today. So just love to hear in the chat if you have put some things into practice from our last session.
Evelyn Perry said that as an instructor for a CHW program, I know she's at OTC down in Springfield, the social determinants of health is often a fairly new concept with her incoming students, which is really interesting since CHWs work so closely on those. So thank you.
Well, we'd love to hear throughout if you have some things come to mind about things you put into practice with our previous session on social determinants of education and health, or with the new topic too. As we go through, we love to have your comments in the chat just to hear the things that are going on right now and innovations folks are trying around social determinants of health. Next slide, please. So today what we hope to talk together about is the role of neighborhood and built environment for our children students and families to talk together about one school district, Eldon, and one local nonprofit and the impact on neighborhood and built environment. And then just to all talk together about ways that we can partner and think about collaboration between schools and community organizations. These are our big challenges. So all working together and all collaborating, I think is where we see the biggest impact. Next slide, please. This is a reminder slide about social determinants of health. I really like how the Cleveland Clinic has described really it's everything around us, the personal, social, and environmental things that impact health, well-being, quality of life, and educational success. So that whole range of things, income, education level, all of those are part of social determinants of health. Next slide, please. And then, of course, today we see that the CDC, they break down social determinants of health in 5 domains, and our ECHO series has aligned with each of those domains. Today, of course, we're talking about number 4, the neighborhood and built environment. So factors related to your zip code and the specific community where you live. Next slide.
And I think this begins mine. So it's so great to see everyone today. And I wanted to first thank you guys for showing up after having to reschedule last week. And that was completely my fault. I accidentally accepted a federal grant review. And this is such an important area for me that I asked our team and our presenters if they would allow us to reschedule, and they did. So thank you for showing up as well. I know on this cold day right after a holiday for many of you. So the neighborhood and built environment is really that's where we live, and it really does have a major impact on our health and well-being. One of the things we're going to look at and talk about a lot today is how the neighborhood impacts the school and the school impacts the neighborhood, because they do. A strong community and a strong school go hand in hand, and we'll hear a lot about that today. So it's where we live, born, work, play, worship, and age. Our built environment is human constructed. It's really those physical attributes of the spaces where we live and work. Things like building and structural features, walkability and recreation. Are there health promoting resources in our community? Things like fast food, liquor stores, strip malls, lack of sidewalks, lack of places to walk, lack of places to get exercise. And then on top of that, we talk about the social environment, which is the socioeconomic composition of the community. So that's things like, is it high crime? Is there a lot of noise? What's the level of community support? Social cohesion and collaboration? Do we work together to make things better for our kids, which we all want to? And then really, is there things like disorder or trash or graffiti, disorderly groups or activities, which can also impact our physical and mental health? Next slide, please. So why does this matter when we talk about health? You know, we are University of Kansas Medical Center, Department of Pediatrics. We work a lot in behavioral pediatrics, but even in the type of physical health, we know that 50% of our health is related to our community, but 10% of that is specifically related to our physical environment, as you can see from the uh, person at the right, excuse me. So it really does matter. And even when we talk about the socioeconomic factors or the health behaviors, right? Diet and exercise, your ability to exercise, alcohol use, what's available. Those are all really impacted by the built environment and the neighborhoods and communities we live in. Next slide, please. So when we talk about Healthy People 2030, which is our goals as a nation to work on, we always want to talk about kind of what are they saying, or what in a world that was healthy for everyone would we have? And so the goal that Healthy People 2030 has is to create neighborhoods and environments that promote health and safety. And the way to do that is to improve the health and safety where everybody lives, works, is born, plays. But when we talk about students and family measures, some of those measures that we as a country are working on are things like minors and young adults committing violent crime, schools with policies and practices that promote health and safety, families spending more than 30% of the income on housing, blood levels, which so impact, education status and success, adolescents who walk or bike to get places, and then asthma and the role that that plays in both health and ability to learn and be in school. Next slide, please. So some of the questions as a school or community member who's thinking about the needs of kids and families that you might ask are things like, do students and families have access to a well-stocked grocery store? Do they have access to the internet? Do they feel safe? Are they safe in their neighborhood? Are there sidewalks? Are there bike lanes? Um, Safe and affordable housing, which we talk about as being paying less than 30% of your family's income for your housing. Is the home and community free of lead? Are the streets quiet and safe, and can they sleep? And then does their housing accommodate the mobility needs they have? If they're ramps or other needs, we see children from low-income families who may have intellectual or developmental disabilities and need accommodations. And maybe it's very hard to find housing, especially in neighborhoods with older housing that meets their needs. Next slide, please. So the neighborhood and built environment and school success, right? This is about how schools are a part and why the social determinants are important to schools, but as well as important to the community. So when we look at the data, we see that the neighborhood and the zip code where a child lives can predict their likelihood of later success. Where you live is linked to things such as problem behaviors, risk for incarceration, and your earning potential. We find that Black and Hispanic Latino families are twice as likely to live in substandard housing as white families. Rural renters, which many of our partners work in rural districts and rural communities, they are more likely to live in substandard housing and to experiencing housing problems related to affordability, quality, and crowding compared to rural homeowners. And we really see that housing stability, right? Being in a house long-term has a really strong impact on educational success. It's actually one of the strongest findings in the literature that children who move around a lot have really difficulty with educational success. So if we can reduce student mobility by getting them permanent housing, we're going to see better educational outcomes for both the children and the schools. Next slide, please. So this really does, and so much of what we're talking about with the social determinants ties into income and ties into jobs and ability to have successful lives and meet the needs of your family. So we see that parental income is one of the strongest factors in how children perform in school and whether they go to college and complete a college education. So we see that children with families from low incomes who live in substandard housing are more susceptible to things like adverse respiratory outcomes, lead poisoning, overcrowding, and environmental stressors. So these negative health outcomes and these negative health effects really impact our children's physical, behavioral, and cognitive development. We see increased school absences, which we know is a real crisis in many of our districts and many of our communities, and also poor academic performance. So children that grow up in poor quality or inadequate housing, which is things like poor quality, clutter, cleanliness, hazards, indoor climate, overcrowding, bundling up, having multiple families or many adults in one house, not by choice. They have higher symptoms of things like depression, anxiety, and aggression in the elementary school ages, and then in young adulthood when children come from higher quality housing or housing that fits their needs. The poor physical quality of housing, things like roof leaks, rodents, broken HVAC systems, is also associated with adverse effects on adolescent math and reading skills. I know this is a lot of data, and of course these slides will be sent out afterwards, but it's really important to me that when we talk about the social determinants that we're able every month, when we address each one, to talk about how this impacts school success and why it's an important area of concern when we want to have healthy schools and successful schools and communities. Next slide, please. So residential instability, which we talked about, really leads to poor educational outcomes. So things like data shows that young children who move 3 or more times before preschool face the most severe negative consequences. So they have issues with cognitive, emotional, and behavioral development. In the early elementary years, they tend to score lower on reading and math tests, excuse me, than families with stable homes. And that really, of course, impacts all the way through middle school and adulthood. Adolescents, in turn, are more likely to have adverse social and behavioral outcomes that impact their educational achievement and educational attainment. So you can see where having strong housing stock and strong and stable housing in the community really does impact school success. So households with low incomes, right? So it comes into income and jobs and availability of housing that's affordable. So those with low incomes, they tend to move at twice the rate of families with higher incomes. And that's generally because of the housing cost burden, structural and environmental housing problems, trying to find housing that's safer and more secure, neighborhood violence that they move to avoid, and foreclosures and evictions. Next slide, please. So housing and the community and the built environment also relates to successful schools. So where we see schools in high poverty areas and racially and ethnically segregated, they tend to have less qualified teachers and lower average academic achievement. School quality is often related to what the opportunity is, as defined by that relationship between schools and communities. So things like socioeconomic status, student distribution, neighborhood influences, access to resources, and economic segregation can all play a role in the school district's success. I bring this up because one of the things that's exciting is this doesn't have to be the situation. You can have high performing schools and successful schools in areas where income, but we have to be aware that income and the socioeconomic status of the communities where schools are located can play a real role in student outcomes. So when we see children living in income segregated neighborhoods that are predominantly populated by those in poverty, those schools are more likely to have disparate access to funding, right? They have lower funding. Often, how do we fund schools? It's based on property taxes. If you have low property tax values, you're going to have low money for the school. And so they have less access to funding and resources than their wealthier peers. So students that attend schools with peers from families with higher income, where the income is mixed in the school district, are up to 68% more likely to enroll in a four-year college than students who attend schools segregated by lower income. So a district that's predominantly, we hear about districts that are 80 or 90% free and reduced lunch. And those school districts, they have a harder time helping and making sure that every student is successful. So a study that Michigan State University did that looked at academic achievement and attendance at the 21 schools in the boundaries of Flint, Michigan, found evidence that school neighborhoods impacted academic achievement. So specifically, students that were exposed or in the school was located in an economically disadvantaged neighborhood, regardless of where they lived, even if they moved in or lived in a higher income area, had tended to have poorer academic skills. So the school and the community go hand in hand, and the success of the community and the success of the school are really related to each other. Next slide, please. So I'll pass off to Evelyn to talk a little bit about one model that the CDC promotes, whole school, whole community, whole child. Thanks, Evelyn.
Thanks, Robert. This model really complements all that Robert has shared. Really, social determinants of health, they go hand in hand with the holistic mindset of the WISC, or whole school, whole community, whole child model. It really, when we're talking about built environment, where we see the whole school, whole child, whole community model figuring in as a healthy school environment. So the idea that when you come to school, it's a safe, warm, welcoming environment. And we see that with things like good ventilation, temperature control, lighting, helping protect students and the adults in the school environment from physical threats such as crime, violence, traffic, and injuries, protecting those in the school environment. Also, around environmental things, really making it a safe, welcoming environment with good air, water, and soil. And the other side of the coin is the community engagement component of the CDC model. So really working together with the school and the whole school community to advance those same things around neighborhood. I think this morning it's front and center when we're all facing a really cold, chilly morning. So on the first point with a healthy school environment, a child coming to school to a warm place, and then on the second side, the community involvement. So I see many on the screen who I know are helping work with community organizations and families around making sure that there's supports to meet heating needs of the students coming to school. So it's really both sides of those coins that we see what we're talking about today, aligning with the WISC model. Next slide, please.
So it's my pleasure to be able to represent two friends of Telehealth Rocks, as well as two organizations and friends of that I see, people that I think are really doing an amazing job, and I think we can all learn from, and I learn from every day. So our first panelist is Matt Davis, who is the superintendent of the Eldon, Missouri School District, and Matt met me about 10 years ago, and he was already doing some amazing, and his community. Matt is always the person who will tell you that it's his community and it's his entire school that's doing it. It's not Matt that's doing it, but he's been a really great superintendent and a strong leader, and also someone who is a visionary, even if he won't admit it. So to kind of start us off, and then we'll introduce our other partner in today's conversation. I wanted to ask Matt to tell us a little bit about the Eldon School District and really its growth and development over the last few years, and why kind of focusing on the community and the built environment. And in that last slide, I was really excited about service learning. That partnership with community businesses, I think, is a really strong component of how schools and communities can partner. So with that, I will ask Matt to talk about the Eldon School District, even though I could talk about it all day.
All right, thanks, Robert. So Eldon is a community of 5,000 people. We are 15 minutes from Lake of the Ozarks and 30 minutes from Jefferson City. Our school district has approximately 2,000 students. A little history: in 2008, our largest employer moved to the country of Mexico, and so we lost over 1,000 jobs. When they left, we lost 3 new car dealerships, and then people were moving out of our community. And so things were definitely rough. And our school was also not doing well academically or financially. Out of 550 schools, based on a state report card, we were ranked about 400th. We had high teacher turnover, and we also had to cut $1 million out of our budget. And so over our journey over the last, 15 or so years, our test scores improved, our teachers are staying, our finances have also improved. Our district for the last 2 years on the state report card has ranked within the top 50. And the school was just instrumental in recruiting a large manufacturing company to come to our community. And so that's just a little history, and then we'll share a little bit more, but that's just, you guys have a perspective of our school on that side of it.
Yeah, and I'm really excited to get into some of kind of how this change has happened and the community and school involvement. So we'll get to that in a second, but want to let our other panelists introduce themselves. Next slide, please, Christy. So Avenue of Life is an organization that I haven't known quite as long as I've known the Eldon School District, but less than a year ago now, there was an article on NPR, and the National Public Radio here in Kansas City, about the work of Avenue of Life. And I was so excited to read about it that I asked a friend who happened to know Angela DeWilde and others at Avenue of Life to introduce me so we could meet. Because when we work with school districts across Southeast Kansas and now Missouri, I always say if I could fix housing and transportation, a lot of our problems would go away. And they've done some really amazing work, and they're in a really amazing organization that really focuses on students with housing instability. And so I wanted to pass off and kind of ask a question of whether Cameron and Angela, or you can both kind of chip in together. So could you tell us a little bit about Avenue of Life and the areas and populations you focus on with your work in housing?
Yes, great. Thank you so much, Robert. Cameron, if it's okay, I'll start. I'll share some things and then you can fill in the gaps. So yes, again, Angela DeWilde here with Avenue of Life. I have been with Avenue of Life for about 18 months, and my passion is shared with Robert in focusing on housing for students specifically. So Avenue of Life has been, let's see, we're 13 years old, founded to serve the community in Wyandotte County, Kansas. So Kansas City is a split city between state line. We have about half in Missouri and half in Kansas. And so I'll kind of talk about what so we have a long history, but I'll specifically talk about the Impact Program, which is a program that partners very directly with our school districts. So as I'm sure many of you know on the call, there is a federal mandate called the McKinney-Vento program with school districts. All school districts are required to identify and support students who are struggling with housing. because we don't want the housing situation to get in the way of their academic achievement and attendance. So all school districts have a McKinney-Vento program where they identify students and then provide them supports like transportation to school, uniforms, direct enrollment, things like that. So, however, school districts are often at a loss or not able to kind of provide like more than what they need for the students. And so that's where Avenue of Life comes in. So we receive family referrals from the McKinney-Vento departments at the school districts. We're partnered with all 4 school districts in Wyandotte County, and we're also partnered with Kansas City Public Schools on the Missouri side of the Kansas City state line. So they, school districts develop a contract relationship with us. They send referrals of families, and then we begin very intensive case management towards permanent housing. And so we have that great partnership with the school district that we're able to wrap around the family and work very diligently within the model of collective impact, which I'm sure Cameron will elaborate on a little bit. So we're able to work really diligently with all of our partners in the community to wrap around families and to really get them on the path towards permanent housing. So that's kind of how we're operating right now. And then Cameron, I'd love to toss it to you to fill in some of the gaps.
Well, actually, that was fantastic. I'll jump into collective impact when we get to that question, but it was a great history, and I look forward to hearing more about Eldon schools as well. Thank you, Angela.
Thanks. Well, we're going to move forward in slides. And I will tell you, the audience, that these questions, sorry, can we go to the next slide? There we go. These questions are a way to have a conversation, but a better way to have a conversation is for you guys to ask questions. So as you hear things and get to know things and have questions about any of this work of any of our panelists, please either put them in the chat, excuse me, or feel free to unmute, because we kind of come up with these questions to make sure we're kind of having some comprehensive approaches to asking questions about things. But we really welcome others and those who are curious or interested or for whom this is important to ask any question they come up with. So kind of starting out, I wanted to ask Matt and Eldon, why was it so important for Eldon schools kind of facing some educational outcomes and other issues to also focus on area of the community needs like housing and economic development and, businesses and jobs? And I know when I first met you, that's what we were talking about. And that's where a lot of our work together came from, was this idea that Eldon wanted to make sure that kids had lived in healthy, successful communities, but also I know you just seriously care about the success of the community of Eldon.
Right. So we believe just if everything's going well in the community, our kids will be doing better. So when Robert and I met, our free and reduced lunch was around 65%. And so today it's down to 50%. So we feel like we've made a lot of progress in that area for our kids and just bringing in better jobs on that side. And so we knew that we needed to train the future workforce at our school. And so our career center has been vital for that, of just getting the kids the skills that they need to be successful. But one thing we started doing was we would do a survey with our seniors who are getting ready to graduate. We'd survey them in the fall, and we'd ask them, we'd say, hey, what are you planning to do after high school? And how can we help you achieve those goals? And so if our kids said, hey, we are planning to go to college, we would make sure that they filled out the FAFSA. We'd make sure that they filled out their application to college. And if a student said, hey, we are looking to go to work right after school, then we kind of asked them their skill set, what kind of jobs they were looking for. And then we really focused on partnering them up with an employer to make sure that our students found just not what I would consider the low level fast food. Not that anything's wrong with fast food restaurants, but just we tried to get them better jobs, maybe working at our local factories in town. And the thing that was nice was that it was a win-win, because the businesses were looking for quality employees, and we could find them the students that had the right skill set so that they would be successful. And so they were jobs with 40-hour work weeks, with insurance, with retirement, some paid time off, and those are things that helped our students be successful. When we did our senior survey, something that really kind of surprised us was the amount of students that did not have a driver's license. And that was another area of focus that we decided to work on because, you know, if we would survey 140 students and 25 to 30 of them didn't have a driver's license, not being able to get around in a community makes it difficult to find a quality job. And so we have been able to help these students get their permit. We would have students use school vehicles to practice driving with some of our staff. Our director of special services, we take students to our country club and use the golf carts and go around the country club of getting them some experience of just what it's like driving a golf cart, then move them up to a school vehicle. You know, if there's people on here that work at a school that might not be legal, so I'm not saying you should do that at your school, but we just kind of roll with it and do that here in our community. Then we also have groups within that we've helped kids pay for their car insurance. We've had people in the community that will donate a vehicle to us. You know, they're nothing fancy, but an older car, high mileage, and somebody gives it to us. You know, sometimes a car with insurance will pay for 6 months of that, can really get a kid onto successful. And so for us, it then helps, I think, on the housing side of, you know, they're having higher income, they can pay the rent that kind of goes with it. And so that is just one aspect that we have on our side.
So can you tell me a little bit about housing? I know this is an area that Eldon, because of the community's success, has struggled with a little bit.
Yeah. So what's crazy is when you do recruit a big business in, it's good and it's bad. So the good is you bring in all these quality jobs. The bad is the housing market supply just goes away. And so that makes it extremely hard for people to find quality housing. And so we have torn down in our community over 75 dilapidated houses so that we can then build back. And then our school district has a building trades program to where we build a house every single year, training those students not only how to build a house and give them those skills, but then the businesses want to hire our students. Like they will go out to where we're building a house and they'll say, hey, I need some people to help me with framing, with HVAC, with plumbing. And they give our kids the jobs. Like they're like, you can start tomorrow. And so those things are really exciting. One of our goals is to kind of build what we would call smaller 800 square foot homes, 2 bedroom, 2 bath, and try to make it affordable. Our school district would like to purchase a dilapidated trailer park. And so we're still trying to work through that process with the city. But there's definitely some pushback, you know, is a school's role to be a developer. But we think it helps both. It could help my teachers find housing on that side of it. It gives my students the skill sets that they need. It just continues to work on providing a niche market that maybe some of the builders and developers in town are not focusing on that type of house just because there's not as much maybe profit margin on those type of houses as there are if you build bigger houses or build more apartment type facilities.
And Matt, this kind of relates to a question that Jennifer asked as well as, you know, college and work, but you brought up trade schools and the military. So one of the questions I would have is, you know, or something that you've told me about that I'd like you to talk about a little bit is even Quaker Windows. You know, you talked about the different job experience opportunities that your students have and what the range of those are. So
Yep.
can you talk a little bit about how you think about both the needs of the community and how students may fill those needs that include things beyond going to college or other types of work?
So we take students, so we load up a bus and we go take a tour of the factory. And so factories today are not like what you used to think of several years ago. And so they are clean, they are nice, they have great benefits. But the thing, even for us, like when we take a tour to Quaker, we want to take the kids that are getting degrees that might be going to college also in accounting, in health sciences, in business, in architecture, engineering, because all the jobs. So when this factory employs 500 people, they have everybody that's working there. And so we take kids who are going to be the line workers, building the windows, working there, but also the ones who are doing accounts payable, accounting side of it, the legal side of it. And so that has been fantastic because we really try to show the broad range. And so my goal is that we have our kids, when they graduate, that they can come back home and live in Eldon, and that there's a job for anyone who wants to work here. And so that has just kind of been a push for us and then when we work with Quaker, we say, hey, what are the skill sets they need? Is there a program we need to offer within our high school so that our kids are better skilled when they start working with you? at Quaker Window. So on day one, they're able to get going. And several schools have a similar, like we call it on the job training, to where second semester of your senior year, you can go and start working at one of those industries so that your skill set's ready to go. So instead of coming to, let's say, building trades and working on the house for 3 hours a day, you go and work at Quaker Windows for 3 hours a day. And so that just allows the kids to make some money, allows them to already get their foot in the door and build those relationships. So again, it's a lot of work, a lot of people making those connections with the businesses and holding students accountable. But we just think it's very successful for our community.
And before we move on to our other partners, I want to ask you to talk a little bit about, so a few years ago now, we had some funding that we gave to the district to help us with technical assistance to school districts that were implementing some of these approaches. And you used it to buy cars, right? That a local dealership had, but that they couldn't really resell. And can you talk about the impact of buying those cars and how you use that to both help students learn skills, but also help students be successful in the community?
Yeah, so, as we were talking about with the driver's license, when we'd ask the kids, like, why didn't you have a driver's license? A lot of them were, well, I don't have a car, I can't afford insurance, my parents can't help take me get those type of things. And so when we talked about those barriers to success, we're like, well, this kid might graduate with a high school diploma, but if they don't have a driver's license, if they're not having a vehicle, if that, like, how can we help them get out of that poverty cycle? And so we told Robert, like, sometimes a car is such a limiting factor. And so with that grant, we're able to purchase a car. We're able to get them the job at any place. I use Quaker Windows a lot, but it could be any place that they have to drive to. Because even though we're rural area, so everything is 2 or 3 miles away. We're not probably as a walkable community as we'd like to be. We're working on that, but you still have to drive. And so all of a sudden, a vehicle to where those kids are able to get to and from work just really does change their ability to be a dependable employee. So like when it's -5, like today, they're still able to drive to work. They don't call in sick. They're not missing it. And so those are things that just make a huge difference. So Robert kind of got that started with giving us the money to kind of get that. And then we start sharing that with other people. And you'd be amazed if you share that story and share about how it made a difference in this kid's life. People are willing to give you a minivan with 180,000 miles on it. And then our auto tech class, so we have an automotive technology class that can then work on the car also. So if it needs new brakes, we're like, hey, we can put the brakes on it. It'll just be the cost of the brake pads. We can change the oil. We can check the tires. We can do so many things here at our school. So our kids are learning how to work on the car. We really work with the kids who get the car of like, hey, check the oil. Make sure your tires are okay. Don't drive it crazy. Like you have to really take care of what we're giving you. And those, again, are all those skills that help our kids be successful.
Well, kind of turning to Avenue of Life and Cameron and Angela, really interested because I really think you have an innovative approach in both partnering with McKinney-Vento, which, school districts are, and they do a great job of making sure often that kids that are unhoused have access to school. But I love the idea of how about we get at the issue that makes them eligible for McKinney-Vento and really work on housing stability and getting these families housed. So Cameron and Angela, I don't know who wants to start, but really kind of how does your program work how do you work with families that really face this insecure housing issue?
Well, I'll go ahead and jump in, and Angela, of course, feel free to interject. So at Avenue of Life, I'm going to give you basically like the map and encourage you also, if this is something that you think might work in your community, if you go to our website, all of our assessments are there. So you can see a lot of the detail and kind of how the process works. But in terms of what we do, when we started, there were 1,400 McKinney-Vento students in Kansas City, Kansas. In the first 3 years, in partnership with other organizations, we were able to reduce that number by 50%. And 95% of those families remain stably housed. And so let me give you a bit of the structure and how that has worked, because it's all about teamwork and with great organizations working together under this collective impact strategy. In fact, I see a lot of people here from DCF, and so they're great partners with us. Super grateful for the way they've invested here in Wyandotte County. So the first thing to look at is, okay, what are all the issues? So we utilize what's called the Arizona Self-Sufficiency Matrix. I'm sure you folks are familiar. If you're not, it takes into account really kind of every facet of a person's life. So somebody may have a decent income, but they don't have childcare. Well, now they don't have a decent income. And so we have to look at every facet, from housing to employment, to income, to food, to childcare, education for the child, for the adult, community support, parenting skills, everything that you can imagine. And we do an intake with the families that are referred to us from the McKinney-Vento liaisons in our school. And I do want to say part of why we moved into this place is because we recognize, though there is the McKinney-Vento Act, and McKinney-Vento liaisons are there to identify those children who are homeless and transport them to their school of origin, we cannot ask our school districts to do the work of housing and stabilizing families. That's a community opportunity. That's what our community needs to do. And we have a lot of organizations that have a little slice or a piece of the pie there. So some organizations work with income, some work with housing, some work with parenting skills. We need to bring these organizations together. And we did that through a strategy called Collective Impact. So I'm going to walk you through what we call the 4 pillars of success. The first one would be the strategy. How are we going to approach it? Collective impact. And what's unique about this strategy, by the way, if you're interested in collective impact, John Kania and Mark Kramer from Stanford really laid out what this process looks like. We've adopted it from them and made it unique to those we serve and the partners with whom we work. But the key thing, first of all, is understanding that having a shared agenda, meaning everybody is working toward the same goal. If you've worked in collaboration before, not everybody is always working for the same goal. And at the end of the day, it's student graduation from high school. We know that a child who graduates high school is significantly less likely to fall back into poverty or to enter into poverty. And so we work with all of our organizations. Some of what we have to do is get stable housing. That's really you've mentioned it already, that without stable housing, the likelihood of academic success is significantly impacted. So we do that. We share measurement systems. We do what's called mutually reinforcing systems. So Avenue of Life works with more than 100 organizations, public, nonprofit, for-profit, government institutions, and we all kind of stay in our lane, but bring to that lane what we do best. So we are not replicating or duplicating services. We're all in our lane in that matrix. So those 16 different domains, we focus on those various areas. And we communicate very consistently. We update one another on data. We make sure that we are all working well together. And we do have a lead organization. That's ultimately Avenue of Life as the backbone. We commit to making sure things get done, and we hire dedicated staff to do the work. So that's the first pillar. Second pillar, which is a little bit unique, and I hope that this is something that you'll think about maybe in your community, is we have a single point of service. So if family is referred to us from the school districts, that family then meets with our, what we call navigators, our case managers, and they do an intake, again, based on that Arizona matrix, the 16 domains. So we recognize what the various areas of need are on that intake. And what's unique is that family then will come to Avenue of Life. We'll just talk about the KCK area that's off the bus line, that has childcare available, where we prepare a meal, where we have everything that they might need at that moment. And when they come, we've already pre-planned the meetings they'll have with the different partner organizations. So picture a large building, and every organization comes to the family and meets the family at that one time. So our referral system is not, hey, you need to meet with this organization, and now you have to figure out a way to get there. And you might not even be told yes, because you may not qualify for the program. We bring all the organizations to the family. They just come one time, well, really 4 times over the course of a month, attend classes, meet with organizations. We bring the organizations to the family, and it changes the ball game in terms of the speed at which you can get the resources to the family so they can get into safe, stable housing. And then our approach to case management is a little different because we allow that single point of service. Our navigators, I think of them as they're playing chess, not checkers. So a family will come in and meet with that navigator, and because they know all of the resources available, they can move very quickly and lay out a path for that family to gain housing. So when we first started, it usually took about a month and a half for a family to get into a position where they had safe, stable housing because of all the partner organizations coming together, moving quickly. As you all know, we have a different world right now, post-COVID, with the inflation, with housing costs. So it takes a little longer, but we're still able to see significant numbers of families get into safe, stable housing. And we're super grateful to have the opportunity to do that.
Angela, do you have anything to add before we kind of move on? You guys are both, everybody's doing an amazing job. And I think we've really heard both from the school perspective, why partnering and paying attention to the community matters, and from community perspective, why if we really want to impact children and students and their families, why partnering with schools to identify those families that need supports makes sense. So I'm going to jump to number 4 and ask really more about, so what are the challenges? And Matt, I want to start with you. I know one of the challenges you faced is figuring out how to have a better housing stock, and so kind of when you talk about partnering the community or helping to develop the resources in the communities that your students need, kind of what are the challenges that you face, or what are the things that are important to think about?
Right. So probably our biggest challenge right now in our community is just the lack of workforce to build the houses that we need. And so, and then even I was talking with the builder just last week, who said there's not as many lots available. And so as we talked about trailer park with 40 trailers on it, the person has passed away, it's tied up in some legal, but it's like we're trying to work on how can we get that trailer park purchased, move those trailers off, then we'd have 26 lots. Our school district kids could work on building those type of things. And so I know sometimes as a school perspective, like we want things to move quickly. And sometimes with the city or the larger governments, these things take a few years to make something happen. And so that is just that has been a struggle for us, just of things when we want to help a kid right now, or we want to do something, within the next month or so. Sometimes the process is slower than what we would like it to be.
So do you think, sometimes when I started working with school districts, one of the things I talked about a lot is we'll see some immediate impacts, but we got to be here for the long haul because yeah, right now, I've started putting therapists in schools or putting a community health worker in school, and you see some immediate benefits, but Matt, how do you help the community see, is it the progress you've made since 2008? Does that help the community have a little more patience for how long it's going to take to impact some of these important issues?
Yeah, for sure. So like even when we talked about tax abatement for some businesses, and so from a school, so I'm school superintendent, and to say that I think it's okay to abate taxes for some manufacturer coming in. So sometimes that's not always what school officials would think. But like our assessed valuation before Quaker Windows came in was like 175 million. That's how much our real estate was worth. And today it's worth almost 230 million. And so Quaker came in 2017. And so in 8 years, there have been more housing, more development, but we abated all the taxes for that Quaker Windows manufacturing plant. But we knew these other things would come into it. So sometimes we have to share with people the long game of like, hey, I know we're going to miss out on some money today. And for the next 3 or 4 years, like we're not going to get that. But I believe long term, this investment, this sacrifice today will help us out long term. And so we are always casting that vision because there are people that definitely question that. And so we kind of go back and say, well, hey, look at where we're at today because of that investment. And so those are things we're always trying to work through. We're always trying to cast the vision of, hey, we were, even talking to the city council, how many houses can we tear down? Can we budget money to tear down more houses? Because if we get that house torn down and a new one built back, the city revenues are going to go up. And so you feel like you're always casting that vision of what are the economic development pieces that help make things go. As a school district, we pass bond issues to always make our facilities, improve our programs, continuing to grow. Our enrollment at our school district is growing because of those things. So again, how do we keep that going? We're always casting the vision. We go to the chamber meetings as a school district. We're involved with the local businesses. We're sharing the highlights, the great things that are happening.
So on the other side of that, as a community organization, Cameron and Angela, and that's wonderful that the idea of being able to bring the services to the people in need of them and the organization to the person is amazing. But I've always said, I can do rural, right? We don't have resources in rural, but we all know each other and we can sit down and figure it out. So when you talk about the type of work you do and the number of partners that you have, sort of, how do you deal with the challenges? How do you kind of keep everyone at the table?
I can jump in on that, Angela. Feel free to interject. So it's always about relationship and trust capital. This is what we talk about, even with our frontline staff. We're always building relationships and executing on building trust. And Rich is really about execution. So the challenges that we run into, it's kind of unique in the nonprofit world, is sometimes some of the other partner organizations may be trying to raise the same funds. So you have to have an extraordinary level of trust, and it's about relationships. It's about relationships, even if you're trying to get HUD funding, because people are people. And so just always treating people with respect, having honor, integrity, doing what you say you're going to do, that goes everywhere. And I'm sure, Matt, that's probably why you folks are having such success, is that you do what you say you're going to do, you build those relationships, and you bring those groups together. It is a significant challenge. The greatest challenge that all of us are facing really is income and housing. But as an organization, it's maintaining and building those relationships, even working through conflict at times. It's always about relationships, whatever it is you're trying to accomplish.
I'll tell you that Matt is my example of grow your own. Matt is and has been invested in Eldon for a very long time. And that, and he does things like he expects his teachers to live in the community, right? And that's important, that he believes in the community. He's part of the community, but he believes the school should be part of the community too. Sorry to speak for you, Matt, but I just had to say something positive, and you're not a big fan of saying great things about yourself, even though you do a great job. I want to pause for a second. We have about 9 minutes left, and I want to make sure there are no questions from the audience, nothing that needs to be cleared up, or just questions before we kind of get into our, hey, what do you think is most important questions for the panel? While we're waiting for those to come in, we'll go ahead with the last question, and please feel free to put those, and we'll definitely ask any questions or clarifying things you need. But really, kind of the final question is really, if you could give a few pieces of advice, what advice would you give when it comes to partnership between community organizations and schools to work on these issues that we've talked about today? And we'll just keep ping-ponging back. So I'll go back to Matt for this, and then let Cameron and Angela kind of close us on this final question.
So one cool thing that we do with our seniors is we do a senior interview, to where we bring in our local businesses, and we have all of our business employers interview every single senior in high school. And it's a win-win. And so we want to do practice interviews for our high school seniors, so that they kind of go through that process. I'm amazed how many times a kid will say, that's my first time ever to interview. We tell them to dress up, look professional. And if they're interviewing for like an automotive technology position, they wear that appropriate clothing of what that would look like, versus if they're interviewing for an engineering position, they wear more of their suit. And that has been fantastic. And so the thing, it's twofold. The businesses are also coming into our school, and they see the great talent that we have within our school district of our students. And the students share with them, like, here's the skill set I have from an automotive technology, versus here's what I've learned in engineering and the pre-engineering classes I've taken at Eldon High School. And I'm amazed how many of our kids can get hired after that day. Or when even Quaker Windows told one of our engineering students, like, when you're done with your engineering degree, you can come back and work at our plant. Like, you're the type of person that we want. And so those businesses know if they hire local kids, they are more likely to stay in their business long term, because they're back home, versus if they go and work somewhere else far away. A lot of times our kids, when they're 30 or 40, sometimes we hope they want to come back home, maybe help take care of parents or different things. So I just think getting the employers into our schools helps them see just how amazing our kids are and the opportunities that they have. So that's something that I would give as advice.
And Angela and Cameron, what do you think is the most important when it comes to your partnership, especially with the school districts that you partner with, which I know it's a number now?
Yeah. No, that's a great question. I think that there are several things. So I'm going to first start with relationships, which Cameron already mentioned, that having kind of regular communication, regular touch points with our partners, our school districts, is very, very important. But when establishing new partnerships, it is really great to first kind of look at the value, look at what we want to do together, and keep that kind of as the guiding star. So, for example, school districts They have a lot of things there that they're focused on. Two very important things that they're focused on are attendance and academics. And so what we do with families has the ability to stabilize that family unit, and both of those things should improve if work is done in the correct way and if families are able to partner with us. So making sure that whenever we partner with schools, we kind of keep their big goals and their big values in mind and make sure that we are aligned with those. It just kind of keeps us guided toward that star. Also, I just mentioned relationships. I also think it's very essential, and we do a strong job of this, is to put it in writing. So whether it's an MOU agreement, whether it is a contract, putting it in writing, really solidifies, here's what we are deciding on together. So even if it's just an MOU, which isn't really binding, but it puts down our agreements on paper. We participate in a lot of MOU and contract conversations, and it's actually really great to get into those conversations, because putting it on paper makes us really decide, this is what we're going to do, this is what you're going to do, and make sure everybody's on the same page. So probably not like a fun part of the job, but those agreements in writing are very, very important. And then alongside that relationship, which I'll end on, that's kind of the way that the partnership can continue to evolve and continue to grow if you start with those firm establishments. So that'd be some advice I have.
Excellent. Well, we only have a couple of minutes left, but I'm going to ask one question. First of all, Matt, or a couple really quick. Matt, have you seen, do you see kids returning to the community after college? And then also, do you see, is this impacting attendance? Are kids attending school better? I know you still face attendance issues, but
yeah. So I don't maybe know the exact number of those that return, but I can tell you the amount of, so I used to always tell the kids who wanted to be teachers, because there's a teacher shortage, that I would hire every single one of them if they wanted to come back and work here in Eldon. So I am now getting nervous because I cannot hire every single kid that wants to come back and work in my school district. Yeah, which that is a great problem to have. And so I'm like, maybe not this year, but hey, we'll find you a job at a school nearby, and then we'll hire you back in a few years when we have that opening. When the question on attendance, so I believe in late start time. So our school doesn't even start till 8:30. I believe sleep is huge. So we start at 8:30. It kind of goes along with everything you guys talk about, better health. We have breakfast in the classroom. We build that community. We try to have that culture, that caring climate. So our attendance has not been an issue. We have community health workers. We definitely go make a connection with the family to determine what are the barriers for you getting to school. And so obviously we have some attendance issues, but really we do a pretty good job.
I know we could talk all day, but I'm going to pass back to Christy and or Evelyn. I can't remember who's next, and we'll finish up for the day. Thank you, all of you. This has been great, and I could talk to each of you all day long, have to as well. Evelyn, I think you will talk about the key takeaways really briefly.
I'm just so appreciative of all that's been shared today. Our key takeaways, again, just emphasizing strong schools and communities are required for student success. Success of students is just as important to the success of the community, and high quality and stable housing are really important prerequisites. I just really appreciate what you've talked about with casting vision and trust. All of those takeaways are so very important. Next slide, please. I'm going through these really quickly. All of these are wonderful resources. I hope you'll check them out. We'd love to hear from you all about resources that you find useful in your work in this area too. And next slide. I'll hand this to Christy.
All right, thank you, Robert and Evelyn, for sharing the didactic about neighborhood and built environment. Thank you to our featured guests, Matt, Angela, and Cameron, for sharing about their organizations. And thank you to our audience for joining us today. So we will send these slides and follow-up materials to your email. They'll also be available on the Telehealth Rocks website and the Facebook page, and those we'll send those out afterwards. And then we hope to see you next month on Thursday, February 13th at 9 a.m. And we'll discuss the social determinant of social and community context.
And I know we didn't get to some questions today. Please email those to Telehealth Rocks, and we'll get those to our panelists. Any questions you have, we'll get them onto them and we'll get you answers. So thanks to everyone. I think that's it, right, Christy? Yes. Have a great day.